The outbreak has sickened people in more than 30 states, but Oregon health leaders say they have not seen an unusual increase in Oregon, and none of the state's cases are linked to the national outbreak. Cyclosporiasis does not usually spread person to person. People typically get sick after eating or drinking something contaminated weeks earlier. To lower your risk, wash fresh produce very well, peel or cook it when possible, and consider buying whole heads of lettuce instead of bagged salad.